We think it's critical that patients who are being pitched these medicines and being asked to go talk to their doctor about these drugs, that while they currently get the medical efficacy and safety concern information in the ads, they're not being told the price of the very medicine that they're being asked to have a discussion about. And that list price, we think, is a part of fair balance, that it ought to be in the ads. And that's why the president committed to proposing a regulation that would mandate list prices in the ads, and that's what we've delivered on yesterday.
The pushback obviously is going to be significant, I guess, but there are some valid points, and that is that, I mean, what price do you put up? You'd have to, I mean, it'd take, the commercial's 30 seconds long, it'd take 30 seconds to explain who pays what and what goes into the payments and rebates and insurance. No?
No, no issue at all. It's their list price. The pharma companies set the list price. You put the list price in the ad just like you put the list price on the car. That's a federal statute, by the way.
That's why they don't want to do it, because no one pays the list price.
Well, no, you know what? They do. That's the problem.
Yeah.
The problem
if you're uninsured,
is
you do.
almost every single senior under Medicare pays the list price or a percent of list price on at least some of their drugs. 47% of Americans under the age of 65 have a high deductible health plan, and during that deductible, they're paying the list price. So I'm not buying the pharma talking point that list prices don't matter. They do matter.
Is there any way to get around this for these companies? Meaning there's been an argument that maybe they won't advertise, or that they're going to try to advertise in a different way in some kind of other format. Is that possible?
Well, we've actually asked for comment whether we should extend this regulation to all forms of consumer advertising, including print and internet. For now, it's proposed for the TV ads, but we've asked for comment on a broader scope of the regulation.
Why didn't you start with everything? Because it clearly will push the advertising to other places.
Well, we'll see the comments that we get. We were focused on the most salient part of consumer activation and the heaviest pharma investment, which is around the TV ads.
Mr. Secretary, obviously transparency is a huge problem. Consumers don't know how much they're going to pay for so many things that they get in health care. This is one proposal. What other proposals are you considering to try and get at that transparency so that people can really act like smart consumers and figure out where they're spending their money and how?
I'm glad you asked about that, because that's really the theme of so much of our work in healthcare that the president's driving, is bringing greater transparency to put the patient as a consumer in the driver's seat, to bring more competition to the system. So that's why we've rolled out an update to the Medicare dashboard, letting people have more insight into pharma price increases. That's why just last week the president signed a gag clause legislation that forbids pharmacists from being ordered not to tell patients that they could get their drugs for a lower price if they just paid cash out of pocket. That's why we're looking at the entire system of backdoor, back-end rebates that aren't transparent around pharmaceutical discounts, and thinking whether those should be pulled forward to upfront discounts at the point of sale for the patient. It's why we're bringing price and quality transparency across the entire hospital and provider health care system.
Who do you think the problem is in this scenario? I mean, if you talk to any of the top executives at the drug companies, at hospitals, at any of these places, they'll all say that they're in favor of transparency. So what's the holdup?
You know what? 5 months ago, the president called for prices to be put into direct-to-consumer TV ads, and I said, you know, pharma could adopt this tomorrow as a voluntary program. They didn't do it, so we had to act by regulation, and we're going forward with that. So if people believe in transparency, they can actually make their prices transparent.
Would you ever think about forcing doctors on the script to actually put the price next to the drug so you actually see it? Because I don't know about you, you go to the doctor writes down the script, you take it to the drugstore. Sometimes you can then figure out the price at that point, but it's almost too late because, you know, you've already put the script in.
I'm glad you asked about that, because that was actually part of the drug pricing blueprint that we're working on. We think you have a right to know not just when you have the TV ad what the drug ought to cost, but actually at the point of prescribing, when you're there with the doctor. We need to get the tools so the doctor knows not just the list price, but also what under your health care plan you would pay for that medicine, as well as the competing medicines the doctor might prescribe, so you can have a more engaged, competitive discussion right there at the point the script's getting written.
But it's probably not the doctor's fault. I mean, I try and figure out who is going to win the most by having this stuff obscured. It's not the doctor who wins on this. It's the health care plan, it's the pharmacy, it's somebody down the line who's responsible for your coverage and getting you to fork more out of your own pocket.
Well, it's certainly not the doctor's fault in terms of having information. My hope is that the pharmacy benefit managers and insurance companies who really try to steer a patient towards one medicine or another under their formulary and benefit design will actually develop these tools, because it's in their interest that the doctor and the patient should steer towards the lowest cost option in terms of the drug for out-of-pocket. That's why they designed those benefits that way.
I don't even understand who the drug companies are really marketing to in those ads. Half the time, I was talking about this earlier, I'm done with the commercial. I don't even know what it's for. It's, you know, they show you people, you know,
happy.
They're in boats, you know, husbands and wives look like they're enjoying themselves. I have no idea what it's for, and a doctor has to write a prescription for it. Does anyone go into the doctor and say, I want some Entresto or something? Is it for doctors? Is it just... What is it for? It seems like it's expensive. I don't know who they're reaching. And they're really just advertising side effects half the time.
Well, what they do is they're trying to get what's called consumer activation. They're trying to prompt a discussion between the patient and their doctor about a medical condition, and I guess ideally what they hope for is that the patient will make a request for that particular drug. That's why we think it's so important that we have this transparency, because we think before a patient spends money to schedule a doctor's appointment, go see a doctor in response to one of these ads, they need to know, is it a drug they even could potentially afford? Is it a $50 drug or a $5,000 drug? We think that's just basic fairness.
Okay, here's one more question for you. Rebates, I think, are a big problem, too. All of these companies can say, look, nobody pays the list price. Okay, well, let's make the list price really the list price. Stop doing rebates. Stop giving discounts back. Are you going to crack down on that?
Well, we have talked publicly before about our concern about this rebate system that we have that creates the incentive for these extremely high and ever-increasing list prices, even as rebates and discounts continue to expand, getting to, you know, flat or net pricing. What we instead think we ought to be considering is pulling those rebates forward to the point of sale. When the patient walks in the pharmacy, let the patient get that discount when they walk into the pharmacy. That's an idea that's worth all of us thinking about. It would be more transparent. It would create a disincentive to these absurd list prices and constant list price increases, and it would decrease spending for patients at the pharmacy. So that's something we all in our system have to be thinking about.